Welcome to another episode of the Clinical Career Collective S.O.A.P News. For those of you who are new to us and our mission, C3 is a professional development community for the mental health professional at large. We are here to support you so that you can learn, advance, and become the clinician the world needs now. You can find us on our website, www.clinicalcareercollective.com, on our YouTube channel called S.O.A.P News, and of course, we are extending an invitation to join our communities over at Facebook, which is at Clinical, the number 2 professional, or you can find us over on LinkedIn at Clinical Career Collective. I'm Amity Cooper, your host and creator of the S.O.A.P News. As a trained clinician, I really benefited from applying the S.O.A.P Note method in my practice. So when I started C3, I thought it would be a fun way to craft a blog series that incorporated the same principles as the reliable S.O.A.P Note. What better way to get updates, tips, inspiration, and reviews about relevant, on-point clinical and business topics affecting our industry today. Today's S.O.A.P Note is about mental health in the workplace. Did you know that the U.S. is the most overworked nation in the world? We spend close to a third of our life working. That's an accumulation of 90,000 work hours over our lifetime. Since we spend the majority of our life working, this S.O.A.P Note briefly explores how we can optimize and improve our mental well-being while at work. The majority of people find that working is good for their mental health. Having a job is good for us. It provides a source of income, a sense of identity, a social outlet, and if aligned, it can give us purpose and meaning. Having a steady routine and structure is beneficial in multiple ways for our minds and our bodies. The work environment gives you the chance to connect with others regularly and form friendships. Working also provides opportunities to contribute and gain skills. However, your work environment can also have a negative effect on you. The wrong job can increase your stress levels, can throw off your opportunities for advancement, and can become discouraging and toxic if the company culture is not in alignment with your personal goals. Building a healthy workplace environment is based on 2 ideas. Happier employees are more productive, and 2, employees experience higher overall job satisfaction and remain loyal to a company if they believe that their company legitimately cares for them. Both factors strongly attest to why employers should care about your mental health. Poor mental health and stress can negatively affect employee job performance and productivity. It can lead to lower engagement with one's work, poor communication with coworkers, and can even affect one's physical capability and daily functioning. There is a strong correlation between mental illness, such as depression, with higher rates of disability and unemployment. Depression interferes with a person's ability to complete physical job tasks upwards of 20% and reduces cognitive performance by 35%. Only 57% of employees who report moderate depression at work receive treatment and/or attention. Worldwide, research has shown that unaddressed mental health disorders result in a notable loss of productivity in the workplace and absenteeism. The WHO, the World Health Organization, estimates that the cost of poor mental health to the global economy is $1 trillion per year in lost productivity. I'm going to say that again. A global loss of $1 trillion in lost productivity. What we now know is learning how to manage oneself is essential to living a productive and happy life. Companies are continually learning and applying new strategies and programs to help their workers train up their mental performance skill sets. Companies and institutions have a responsibility to adhere to health and safety guidelines and legislation. This includes making sure that the working environment is safe, protecting staff from discrimination, and carrying out risk assessments to better understand what their workers are facing day to day and provide additional trainings to help their employees become better, happier people. We're starting to see a real shift in corporate America. Data and research support this notion that in order to flourish, our mental health well-being is essential for people to be successful in life and at work. Building strong mental health support systems at work create an atmosphere of acceptance and opportunity. If staff feel that they can talk openly about their mental health, problems are less likely to build up. This could lead to less time off for a mental health issue and improved morale in the workplace. For some of us, having an overall sense of a positive and optimistic outlook comes easily. For others, it doesn't, and that's okay. We now know from research that these skills can be trained. Sports psychologist Dr. Michael Gervais says it best. We can train 3 things in life: our minds, our bodies, and our craft. Individually, we can be working on our nutrition, exercise, rest, and recovery. And at work, we can practice and improve our social connections and interactions. In combination, we can continue to strive to be our best selves in action. Before we end, let's go over some tools that you can share with clients who want to protect and nurture their well-being at work. Make an appointment with your company's HR specialist. See what kind of professional and/or personal development programs they offer their employees. Workplaces can provide free or subsidized coaching, counseling, or self-management programs and host seminars or workshops that address depression, stress control methods, mindfulness courses, breathing techniques, and meditation. It's amazing what's being offered through your workplace today. Employee assistance programs, which are called EAPs, are also staffed with social workers, psychologists, psychiatrists, and other mental health professionals. These well-trained professionals provide employees with a variety of confidential counseling services to assist with their mental health needs. We can all take steps to improve our mental health and build resilience, our ability to cope with adversity. Self-care is an essential skill that needs to be practiced. It isn't easy, especially if we feel anxious, depressed, or suffer from low self-esteem. Here are some actions everyone can take. First off, find someone to talk to, whether it's a professional or a friend. Eat well, stay hydrated, take regular breaks from your desk, move your body. Find a mentor. Having someone in your corner is essential in today's economy. And get better at developing your work-life balance sweet spot. Lastly, if you're interested in learning more about this new and cutting-edge technology affecting our mental health practices today, then I'd like to invite you to register for our monthly S.O.A.P newsletter. With this subscription, you will receive a monthly review of all the weekly S.O.A.P notes, gain access to our member-only interviews and conversations with special guest speakers, and you'll have a chance to purchase our monthly S.O.A.P box that contains products, coupons, and discounts to all our mentioned items reviewed during S.O.A.P note recordings. I'll see you next time to your clinical success.